I'm Dr. Ryan Stanton, and the doc is in. I wanted to take a couple of minutes to talk about a term we've heard quite frequently recently with regard to COVID-19, and that's the idea of herd immunity. Herd immunity is an epidemiologic term regarding the number of people who've built an immunity to a virus, thus protecting those around them that don't have any immunity. The challenge is that herd immunity typically takes at least 60%, but often 70 to 90% of the population to have developed an immune response to a particular virus in order to protect those around them. This can happen in two different ways. First is by actually getting the virus, thus the normal immune system building that response to this virus, fighting it off, and protecting them moving forward. The other is through vaccines. That's what we see with other viruses, such as smallpox, measles, things like that we get childhood vaccines and vaccines throughout our life. It fakes the body into thinking that it's had the virus, thus producing the immune response, but without the potential dangers of the infection itself. The problem with COVID-19 is even with generous predictions on the amount of exposure in people that have been seen with this virus, it's likely somewhere around 10-20% in some areas and cultures. The problem is that's nowhere close to the numbers necessary for herd immunity, meaning that we are not protected at this point, even with higher estimate predictions. Thus, we have a lot of time left with potential exposures, illnesses, and unfortunately deaths. I think the most likely outcome is going to be that the creation of the vaccine itself will help to protect and be able to provide prevention for a lot of folks and get us to that point of herd immunity. Unfortunately, I don't see us making it there on the natural path without significant attrition and deaths along the way. So, stay focused with that social distancing, hand washing, personal hygiene, cleaning surfaces, and let's take the appropriate steps to protect each and every one of us from COVID-19. You can join the conversation on our Doc is In Facebook page and at EverydayMed on Twitter. I'm Dr. Ryan Stanton, and the Doc is out.